Now, perhaps, Mr. Nicolaus, let me speak to you about this outbreak, the fact that it was linked genetically to cases also reported in Angola, that we understand. The issue of cross-border movement, does it increase risk of transmission, and how is Namibia possibly addressing this risk?
Yes, you see, it's a disease, and remember, diseases are transported by people. Yes, so as you know, the population movement between Namibia and Angola, it's everyday things. So we are like the same person or same people. So of course, when you have cross-border movement, you are likely to also transport whatever is in your country to another country. So it is a risk, but we just have to do our part in order to minimize that risk. So when you have people moving from Angola, which has been battling this disease for a couple of years, so you run a risk of them importing it to Namibia, and that's why we're saying it is linked to that one. So now, us as a ministry, we do our part, and which is to vaccinate. So of course, routinely we are vaccinating against polio. But now this is a different type of polio from what we used to vaccinate routinely, and that's why we embarked on this campaign, in order to make sure that our population is protected from this type of polio. So we do, as a ministry, also, like my colleague was saying, so that we do surveillance. It's also part of an intervention to make sure that whatever is coming in is under check, so that we detect on time, and then we put intervention in place.
Madam Devi, we understand that the Polio Emergency Operations Centre has been deployed, and you know that the MIS pillar teams have been across all the 14 regions, and you know, what's the role of this team? And some people might be thinking, okay, if you're talking about it was detected in sewage water that is coming from Rundu within Kavango West, what does that have to do with sewage water that we might find in Ongwediva, we might find in Okakarara, we might find in Windhoek, or we might find in elsewhere? What is the connection? Why do we need to send teams across all the 14 regions?
Thank you very much. Remember, it's a virus, and a virus can spread rapidly. There's absolutely nothing that can stop a virus just from spreading. So it can move. It can move with people. It can move in the environment. It can move from anywhere. So first of all, we should remember it's a virus. So the deployment of or the activating of the incident management system is just to make sure that we respond properly. You know, in any outbreak or any type of emergency, the moment you have, you declare it's an outbreak or it's an activity that needs a response, you put up pillars. So you put surveillance, you put vaccination, you put coordination, so that you just coordinate better, ensuring that no child is left behind when we respond in the campaign.
Now, Mr. Nicholas, you being obviously responsible for one of these functions and being an incident manager in terms of polio response, you know, let's talk about the cold, chain and vaccine management, which are also emphasized in your response team, that we understand, the confidence of the ministry, the country's readiness to maintain vaccine quality, especially during this large-scale campaign. We know this is not a small one, because, I mean, you're talking about all 14 regions, 121 constituencies. We have 3 million people in this country. Is this vaccines also for everybody? And perhaps maybe in terms of also your response when it comes to the issue of coordination between the regional health directorates, the district teams, and emergency committees and partners, how are they working all together as a unit to ensure that we all achieve, what we're trying to achieve with this campaign?
Yes, thank you very much for the question. It's very crucial. And I'm actually a deputy incident manager. Yeah, talking about the cold chain, like we said, Namibia, or the Ministry of Health, is already providing routine immunization. And all the vaccines that we are using in our routine immunization, they are in a cold chain. So we already having a cold chain in place. So of course, a cold chain It's equipment. It's equipment involved. Of course, if there is, they can break here and there. But for this campaign, we have already have a basis that we have established. Before, a few weeks ago, we conducted a cold chain inventory, and just to make sure that all the regions, they are sorted when it comes to cold chain, that they have refrigerators, functional, that they have also the cold boxes that need to be employed during the campaign, and the vaccine carriers. Now, so when it comes to vaccine storage, we are sorted. We don't have a challenge with that. Now, as a response team, it's not only the ministry. That's why we're talking. We have WHO here. We have UNICEF. We have other partners, CDC. We have stakeholders. So a week ago, we had a team, teams from all the regions that we brought together to strategize, so that we see how we'll deploy teams. We have written letters to regional governors, our key stakeholders, Minister of Education, because remember, we are targeting children that are under 10 years, and a lot of those children are in schools. So that's why we need Minister of Education as key stakeholders, because then we will also go to schools to vaccinate them. So we are liaising with everyone. We have our communication pillar that are doing all the work actually to reach out to everyone, so that they are sensitized about this upcoming campaign. So we work with stakeholders, we work with traditional leaders, political leaders, so that they sensitize their subjects and whoever they are working with.
Yes, ma'am, talking about, reaching out to all this variety of stakeholders, maybe parents might be confused, especially those that might be watching when they hear vaccine-derived, poliovirus, what do they need to know and to understand that, for those that might be saying, wait, already, my child was already immunized for polio. How is this different? Is it really necessary? So especially the caregivers and the parents, what's the message for them out of this campaign?
Thank you very much. It's important for them to understand that the type of polio that we detected in the storage is type 2. There are 3 types, 1, 2, and 3. What we currently use in our routine immunization is type 1 and type 3. The type 2, we continued many, many years ago in 2016, because the scientific data has shown that type 2 is not a problem anymore, the wild poliovirus type 2. That's why we switch. Actually, the whole African region switch on a particular day to just start using 1 and 3. So the type that we are seeing that is causing a problem is type 2. And the vaccine that was brought in through the Global Polio Eradication Program that is supported by many different partners is type 2. So it's a different vaccine from what we currently have in the routine immunization. And immunity against 1 and 3 does not give you protection against type 2. That's very important to understand. And parents should not be worried because they're hearing the term vaccine-derived. This is a laboratory term that is being used to see that this virus, for how long is it in the environment. And based on the data, it is there for more than 12 months minimum that is circulating. So yes, initially it is a child that was most likely immunized, where we don't know, because the first cases of this type 2 specifically was seen, I think, since 2020, and then since then, it just does not stop. It's moving from country to country. So it's a term the laboratory used to show that this originally virus has evolved so much that yes, initially it's probably coming from a child that was vaccinated, and because it's going through it's oral, and then it's excreted through the feces. So then for some reason, there's a lot of things that sometimes we can't explain inside. It remains in the environment, it survives, and then it starts mutating, changing the form, mixing with other viruses, and then it creates another form that behaves exactly like the poliovirus type 2.
Okay. Well, as we begin to wrap up our conversation this morning, sir, perhaps maybe, especially for parents, who, and caregivers who might be watching at home, what are the steps that they need to take when, these members of your team come to their house, or even schools, perhaps, maybe for those teachers that might not be watching or might not ever come across this information? What should they do when the vaccination teams arrive within their community or vicinities and their homes?
Yes, of course, they will be informed. Already this week, we'll have our mobilization teams going around informing parents and caregivers as to when are the teams visiting the area. So and they will ask them questions. Of course, the teams, when they visit the houses or whatever the case may be, maybe a school or so, they will ask the children that are eligible. In other words, those that are under 10 years old. And then, of course, they will also ask about, remember we are talking about surveillance also as part of the campaign. They will also ask if there is any maybe child that was seen having some symptom of paralysis. So because we are not only vaccinating, but we are also doing surveillance. So all these questions will be asked. So what the parents need to do is just to avail their children to get vaccinated. So they need to provide also the documents so that we see the age, whether they are under the age that we are targeting, and then they get vaccinated, and then they will be marked also to indicate that yes, so this child was vaccinated. Of course, they will be given information also as to why we are vaccinating. Yeah, so that's how we'll go about it. So we'll visit homes, we will visit schools, we will visit all the areas that we would think there will be school. I mean, there will be children that we are targeting. But also, like I said earlier, that's why we are also engaging traditional leaders or church leaders so that they also guide us as to where are these children found, especially those that are not in schools. Remember, there are some settings where we hardly, as health workers, know where they are, but we also have community health workers that will identify where our children that we are targeting are, so that we are able to reach out to them and vaccinate them during this period.
Well, unfortunately, running out of time. Ms. Rosalind, is there anything else that you might have left out that you want to share?
We are not new to responding to a polio outbreak. I think many of us can still remember 2006. We came together as a country, as a nation, as partners, and we successfully dealt with it. So there's no reason for us not to do it again. Thank you.
Thank you so much.